Hey, I'm Jean Russ. I am the CEO and co-founder of Primary Record. And I've got, who are you?
Chris Ross. I am Chief Medical Officer and founding member, founding member of Primary Record.
No, but also share, what do you do in your community?
Oh, okay. Yeah, I'm an emergency physician. So I work at 5 different emergency departments. Actually worked last night overnight. So I just woke up from a nap after working overnight 8 hours at one of our hospitals.
And then, you're recording this with me, so thank you. Because I've got this question that we hear a lot from families, and I can see why families think it, because nurses and doctors are always at a computer, it feels like, right? Like they're always typing something or putting information in. And one of my favorite stories when I was doing care coordination with my older adults is this wonderful gentleman in his 90s. He didn't really believe me because he told me, he's like, well, they're putting it in the computer, Gene, so everybody else knows. So how does it look like on your end as an emergency room physician when you're trying to piece together what the family's telling you or the patient's telling you, and then you're turning to this like electronic health information system? Can you just give some clue on how accessible all someone's information is to you as an emergency room physician?
Yeah, for sure. So, I guess it depends on a couple of things. It depends on where their home system is. So if they're a complex person, they see multiple doctors. Maybe they have a cardiologist, a primary care doctor, etc. If they all are in the same health system, sometimes I'm able to get that information. A lot of the times they share the same electronic medical record system and I'm able to access the information. So that's one thing. If they have different electronic medical record systems with different systems, it's a lot more difficult to get that information. That being said, if they're a complex person, they have a lot of different notes in that individual electronic medical record system. So even if they're in the same system and I can get the access to the information is generally like super overwhelming. Like, I saw
And
somebody.
I'm
Yeah.
sure you hear from families all the time because they like ask you like, well, why don't you know? Like, what are some of those questions you hear from families that they're just kind of dumbfounded that you don't know as the doctor about their health?
I'd say like their medications a lot of the times, even if they're going from a different system to our system, they expect for that information to transfer. Like, I go to St. Francis, which is another local hospital here. Can't you get that information? Well, even though they use the same electronic medical record system, that electronic medical record system and ours don't talk to each other for medication. So it doesn't cross at all. So I can dig through the chart and try and look at each individual note and hope, roll the dice and hopefully I get the information I need about their medications. But that's probably the one that people think that crosses over the most. And so then not everybody brings a med list to the emergency department. So when they don't, they expect the computer to know. It's like just shooting blind and like, okay, well, I guess I just won't know that today and I'll just figure out what I got to do otherwise.
Gotcha. And then, and when you say a medication list, so describe, in the ER, like, because I remember that in critical care too, like as a nurse, like you get some of those patients where it's like, because of that complex history, it's just, that it's going to take a lot of time. Like, you just know it's going to take a lot to like figure out what's going on because you just want to take the best care and do the best job with that patient or that family. And so describe like in your world, like that situation where it's a little bit better because the family has done this or it comes with this. Like, what's your ideal family, like, or patient like that?
Oh yeah, totally. If they come armed with information that's helpful for me, it's like a total game changer. Like I literally will change the labs I order because they're on certain medications, or I'll be concerned about something that I wouldn't have been concerned about afterwards because I know what sort of medications they take. Where if I go in blind, I'm just kind of shooting a broad net and hoping that my guesstimate of what they might be taking is accurate, but that's not always the case. It's been multiple times where I'll go back, for example, like patients on Coumadin or patients on blood thinners, and I'll go back and ask them. And and then later on, I'm like, I'll do a bunch of tests and stuff like that. And then like their daughter comes in with the med list an hour later or whatever, and they're like, yeah, I'm on Coumadin. Did you know that? Well, no, I didn't. And you have to go to surgery now. So now your surgery is the next day, and we don't know if we need to change that and stuff like that. So there's a a lot of the times things like that, like make significant changes in your care plan that I make in the emergency department, just because I didn't know that information up front. And then finding that information, like I said, is darn near impossible. Even if all of your doctors are in my EMR, sometimes the
What's
medications
an EMR?
oh, sorry, electronic medical record systems. So like if they share the same network, like I work at one local hospital system, if they all go to that one local hospital system, a lot of the times the medications are relatively well updated, but sometimes they're not still, and I can rely on that. But I still have to look through and dig through charts and stuff like that to ensure that that's the case.
And then
I was kind of rambling, but
it does. No, I think, well, because it was bringing up this thing, because it's been funny for me, in helping and supporting the work we're doing at Primary Record, you've become more aware that patients have access to data that sometimes you don't as their doctor. So like the favorites, because of course I benefit from all the stories, that you share, but can you explain like now what you find yourselves doing to that patient and that family when you know that you're not going to have access to, they do? Like what?
Yeah, so if there's a critical piece of information that I think that their home-based hospital electronic medical record system should have, then I'll ask them to pull up their patient portal on their phone while I'm taking care of them. So like, I mean, with crazy stuff, like, I just had brain surgery last week and now I'm here and it's 1 o'clock in the morning and nobody's going to answer my phone calls from somewhere else. So I'm relying on you and your smartphone pulling up information that pulls up like a read for an image that I compared to the read. And I mean, that's happened multiple times, and it's frightening that's what I rely on. And there's not much else that I can like do to kind of cross those boundaries, because patients have access to that information where I don't. And I know because of work with Primary Record that that's the case.
Right. Well, and a lot of people don't understand why you don't have access is because of HIPAA, right? Like, I mean, there's good intention that someone's data isn't just being shared all over, but then there's these moments in our healthcare journey that you're experiencing as a provider and that family where it kind of works against us. And so that ability for patients, I think that's a little bit of why we have patient access, is because we can't always guess all those moments. And then my last question, because I'm realizing now I have another meeting.
No, nice.
Is oh shoot, it was the whole idea of what we hear all the time is will like the data or like those lists that families make, or that do you as a doctor trust it, right? Like, so this whole idea of like, even if someone used a primary record, let's say, and we put data in one place and made a nice report to share with you, would you trust it, Dr. Chris Ross?
It's funny like that. So that question never came up until I started working with Primary Record. Like not because it like shouldn't have come up, but it just never came up for people that aren't in the situation. Like when I'm taking care of a patient, it's pretty much always understood between me and them, even in nonverbal communication, that what they hand me is like gold. Like I trust that 100%. Like if they crumpled up, I always joke about it, crumpled up piece of paper in a wallet, which I see daily, they'll hand to me, and that is golden. Like that's what I trust. That's what I go by. I trust that more than what's in my electronic medical record system. And almost every physician would agree with me on that. And like that's just kind of been understood. But when we're talking to people about Primary Record and things like that, there's been a lot of people that have questioned that's like that I would actually trust that. And which is like been eye-opening, because it's always been like like for 16 years, I've always just understood that whatever the patient tells me and hands me, like I'm going to believe that over just about anything else.
No. Well, thank you for your time. This has been enlightening.
Thanks for your time. It's been good. All right. And good luck in your meeting.